When trying to conceive, one of the most frequent asked questions is, when is the best time to have intercourse to increase your chances of conception? To answer this question, there's two things we need to look at and understand. First, ovulation, when do you ovulate? And secondly, your fertile window. And I'm going to make it easy for you in this video. I'm Magda, Wright, and I'm a fertility homeopath. And I help couples to overcome infertility and conceive naturally. If you like my video, please give me a thumbs up. Click on the bell to subscribe to my videos so that you get notified when I upload the next one. Before we look at fertile window, let's look at ovulation. Often I get asked, so on which day of my cycle do I ovulate? Well, generally, if you have a 28-day cycle, it would be on day 14, so in the middle of your cycle. But as we know, not everybody got a 28-day cycle, and there's other factors that may influence ovulation. One way of tracking ovulation is with ovulation strips. These strips measure the luteinizing hormone in your urine. Luteinizing hormone, or LH, gets secreted by the body to tell the ovaries it's time to ovulate. So when you see a surge in your LH, you know ovulation is about to happen. Another way of tracking ovulation is by charting your basal body temperature. This involves taking your temperature every morning before you get out of bed. Just after ovulation, you'll see a spike in your temperature, and then you know your body did ovulate. Unfortunately, it would only show you that ovulation has happened and not that ovulation is about to happen. So you need to do a few months to see a pattern. Charting is not for everyone. If you're a shift worker, if you get up frequently at night for young children, or if you travel a lot, that may distort your charts. Also, with ovulation strips and charting, some of my clients feel it adds to too much anxiety and it's too rigid, all this charting and checking. If charting or ovulation sticks aren't for you and you feel it adds to too much stress and anxiety, which frankly, keeping your stress levels in check when trying to conceive is important, there are different ways your body would tell you naturally that ovulation is happening. You may have an increase in libido. If you check your cervical mucus would become more fluidy, almost like egg white, around ovulation to prepare for sperm to enter the uterus. And also cervical mucus feed the sperm and help the sperm to get to the egg. You may find that you get more clumsy and forgetful. You may have tender breasts. You may be able to feel on which side the egg is released. This should never be overly painful, but just an awareness. Changes in your cervix, temperature changes, or even a heightened sense of smell and taste. You may not be aware of some of these, but your partner may be well aware of these changes happening during your cycle. So now that we establish when you ovulate, let's look at fertile window. To look at fertile window, we need to look at lifespan. Lifespan of an egg, lifespan of a sperm. Do you know that the egg is only viable for 12 to 24 hours after ovulation? Sperm, on the other hand, got a much longer lifespan, and healthy sperm can have a lifespan up to 7 days. I would normally advise around 5 days for healthy sperm, just to be prudent. So that means intercourse for 5 days before ovulation and just after ovulation would give you the optimal chance of conception. But sometimes I see people advise to have intercourse daily, sometimes twice a day. Please don't do that. Sperm takes around 36 to 48 hours to mature. And as you know, you want to get the best sperm, so you need mature sperm. That means intercourse every second day is adequate. And that also means no masturbation during the fertile window to make sure sperm is healthy and mature. So there you have it. When do you ovulate and when's your fertile window? Baby dust to you.